When I was in nursing school and I was doing my bedside hospital nursing placements, I totally freaked out because I realised that it wasn't the type of nursing that I wanted to do, and I had no idea what other types of nursing there was that I could go into. And I mean, bedside nursing is the thing that they mainly prepare you for at uni, and so realising that it wasn't for me really upset and scared me because, like,
what on earth was I going to do?
When I graduated into community nursing. So my community nursing placement changed my life and also my perspective on what nursing could offer me and what nursing could look like as well. I was incredibly fortunate to land my first ever registered qualified nursing role at a GP clinic doing community nursing as a practice nurse. If you're new here, hi, my name is Charlotte. I'm a registered nurse. Today I'm going to be sharing with you everything about practice nursing because I think it's about time that primary healthcare gets its little time on the spotlight and gets to show off just how amazing it is. Before we get into everything, don't forget to like, subscribe, do all of that good stuff. But for now, let's dive right in. So I wanted to make this video, as I mentioned before, because in nursing school, they really just focus on secondary healthcare, hospital-based bedside nursing. And I think that this is an incredible shame because there are so many opportunities within primary healthcare for nurses which I don't think people are actually aware about, especially when you're studying and just kind of new to the whole healthcare world. Like, it's really difficult to know what actually is out there if you're not told about it. And the other reason that I wanted to make this video is because during my placements, whenever I brought up that I wanted to go into community nursing as my first nursing job, I got told so many times by hospital trained nurses who were maybe a little bit more mature in age that I could not go into primary healthcare first, that I should do my hospital training and then within a couple of years then branch out into community, which, looking back on, you know, those comments now, having the experience that I have, you know, with my first nursing job being in the community, I think that that take is a load of bollocks. I thought that making this video could encourage others who may have also been told the same thing to consider primary healthcare and also feel reassured if this is the route that you are taking. So this video, I'm going to start by explaining like what primary healthcare and what practice nursing is, what I do as a practice nurse, what my day-to-day looks like, and then I'm also going to go through some pros and cons of practice and community nursing, and that will be today's video. So starting off, what is primary healthcare? So to start on the other side, when you're up at the hospital, it's typically because something has gone wrong and you're needing ongoing treatment or a cure. So that is secondary and tertiary healthcare, and that's all about treating, curing, receiving specialized treatment and health advice. And it's often very biomedical, very clinical and diagnostic, and it's very, very different to primary healthcare. Primary healthcare is typically a patient's first point of call with the healthcare system. It is community-based and it is about protecting, promoting and improving people's health. There's a lot of prevention techniques, so preventing people from becoming unwell or injured in the first place and preventing them from having to go into secondary healthcare, so they never have to go up to hospital anyway. So for example, when we vaccinate people against whooping cough, we are stopping or reducing their risk of getting whooping cough in the first place and then maybe needing to go up to hospital to get treated for whooping cough. So as you can maybe tell, primary healthcare is essential because when primary healthcare works, we reduce the workload for our colleagues up in secondary and tertiary care, and we help keep our populations healthy and thriving for as long as possible, which in turn has benefits for keeping people in work, keeping people contributing to society and to our economy. So if you're looking at it from that lens, primary healthcare is pretty important for that. Because it's in the community, I've definitely noticed a very stark contrast between primary healthcare and secondary healthcare. So I found that primary healthcare is a lot more holistic, and when I say holistic, I don't mean like our spiritual health or, you know, alternative therapies and stuff. When I say holistic, I mean in the way that we are able to focus on the whole person, not just the clinical thing that they are presenting to our clinic for. And we're able to connect with the patients and their families. We're able to look at the whole picture and pick up on anything else that may need addressing. And I really love that about my job. So as I said before, my job is as a practice nurse, which is a type of community nurse who works in a general practitioner's or a GP clinic. So my role is to follow doctors' care plans for patients. For example, if a doctor prescribes B12 injections for a patient or requests asthma education, then I would be the one that was doing that. But as a community nurse, there's also a lot of freedom and autonomy within our own practice. So we're the nurses who will do your annual diabetes reviews and your cardiovascular risk assessments, and we're the ones that run that appointment. We also get trained and qualified to vaccinate, which we have autonomy over because we don't need doctors to prescribe the vaccines for us if they're on the schedule, and that's pretty cool. So we do all of the wound dressing and care plans and management for those, and we work really closely with the doctors and other healthcare colleagues. So for example, at my clinic we also have a community pharmacist, a mental health nurse and a health coach who we go back and forth with and make referrals collaboratively with each other. And we also do a lot of referrals to other community groups. So for example, when a wound becomes chronic or needs better wound dressings or ongoing treatment, we do a lot of referrals to district nurses. We do a lot of diabetes referrals for like podiatry. For our before school checks for our 4-year-olds, we would do referrals to health and vision technicians or to the childhood development unit if we suspect anything like ADHD or autism, just to get them prepared and with the right support for when they start school. So yeah, I'm pretty busy. So let's just run through pretty much everything I do, everything that I'm training to do, and everything that I will be doing eventually in the future when I'm a bit more experienced. I've got my list over here, and it's a long list. So the things that I do, so we do a lot of injections, so that can be intramuscular injections like your B12s, and then we also have like testosterone injections. So our clinic actually does a lot of gender affirming care for our transgender community as well, which is amazing. We also do subcut or subcutaneous injections like your Zoladex. Vaccinating, that is one of the main parts of my job. So we vaccinate from 6 weeks. We have the schedule vaccines, and we also can do travel vaccines. So vaccinations are actually one of the biggest parts of my day and one of the things that we do the most frequently. We do a lot of wound dressings and wound management, which is like my favorite part of my job. I love doing the wounds and kind of figuring out what to put on everything and just kind of tracking its progress and seeing it improve. So yeah, I love doing that. So wound dressings and wound management. We do ECGs, we do infusions as well. So the main ones that we do are iron infusions, cluster infusions, and then like rehydration. So if someone comes in dehydrated that can be managed in the community, we would do that. We also do community cellulitis protocols. So that's like a 3-day treatment where the patient comes in for an IV push of cefazolin. We do a lot of asthma and spacer education. So specifically, like a doctor will diagnose them with asthma, prescribe them their inhaler and a spacer, and then as the nurse, we're the ones that show them how to use the spacer. We do a lot of vital signs checks, especially blood pressure checks. We do the diabetes annual reviews and the foot checks, which I'm technically trained to do, but I haven't done any yet. So I'm like sitting in with my colleagues on their ones and just kind of taking notes and seeing how they run and stuff. So I'm getting to do that. We also apply continuous glucose monitors, which I've done 2 of these on 2 patients. So I can do that, and I actually quite like doing that. It's really fun. We do our before school checks, which in New Zealand, if you turn 4, you're about to start school the next year. It's like the last minute check in with the parents, see if they've got any concerns, and it just lets us do some referrals if they're needed to get you the right support and resources before you start school, so that when you start school you're kind of all set up. We do cardiovascular risk assessments, cryotherapy, which is like your liquid nitrogen. I hate doing that, but there's always going to be something. We do a lot of swabs as well, so STI swabs, HPV swabs, throat swabs, wound swabs, all of the swabs, we do them. We do urine dipstick tests, We do recalls, so for example, if vaccinations, we have lists of people that are due for their vaccines and we'll call them up and say, look, do you want to come in? Can we book you in? We try and get people to come in and get those recalls done. Referrals, inboxes, so this consists of getting instructions from a doctor and calling patients and generally informing them of their results, or giving dietary and lifestyle advice, or following up with or for the doctors. We do basic triaging for walk-ins. We're not an A&E clinic, so we're not accident and emergency. We don't have an accident emergency attached to us. We're just a GP, but if someone walks in and they're looking pretty grotty, then we can do like all of the basic obs, getting a really thorough, complex health history from them, figuring out kind of what's going on, and we fill it out into like a triage form so that we can decide if we need to call an ambulance, get a doctor. It helps us make a plan. So basic triaging for walk-ins. We do removal of stitches and staples, and then setting up minor surgeries for the doctors, so we set those up for them. We sterilize all of our equipment on site, so nurses also do that. We do medication and emergency bag checks, which are monthly, and then we also have our practice meetings where everyone from the doctors, the nurses, our mental health nurses, our health coach, our pharmacist, reception, all of us gather for like a 8-weekly or 6-weekly meeting. And then we also have our own nurse meetings, which will be just the nurses and our practice manager. So yeah, that's everything that I currently do. And then training to do this month in October, I'm actually getting my cervical smear and cervical screening course done, so then I can start doing the smears and getting signed off on that. So cervical smears and screening I'm training to do. We do a lot of those. And then also cannulating. So I've cannulated my colleague twice now, so thank you so much, because it's really been helpful. The problem with primary healthcare is that we don't have a specific course to get officially signed off or trained and stuff. So we follow the Koawatea theory course or the ACE Hub cannulation theory course, and then you're kind of just left to get physical practice. One of my colleagues, he was like, you can practice on me, I give you full consent to practice and stuff. So I'm practicing cannulating with him when we have free time. I feel like I'll just keep practicing until I'm really, really confident, and then I can start cannulating patients. If you're up at the hospital, there's a proper course and training and stuff that you get put through. But as I say, primary healthcare is really under-resourced, and the hospital won't let us up to do the courses with them. So we're kind of just left to somehow acquire the skills, which is really, really bad, but that's also just the reality of the situation. So cannulating, I'm practicing on my colleague and getting that slowly signed off. And then finally, what I will do in the future is I will do phone nursing. So we always have a nurse on the phones. That nurse helps patients who call up book appointments, get health advice, look at their prescriptions, triaging. I don't have enough experience and knowledge to be able to do that yet, so we're just leaving that. So within the next maybe year or so, I'll start slowly kind of getting onto the phones and doing that. So as you can see, it is quite a lot of things that we help people with, and there's actually probably a lot more that we do that I just can't remember off the top of my head. Everything I've listed is like the main things that we do. So my day-to-day is both structured and predictable, but also very, very varied. So I always start work at 8 o'clock in the morning, and we have a nursing huddle from 8 until 8:15. So we just kind of go over any updates, which doctors are working, anything we need to focus on, any debriefs, and then we also just do like a cute little general check-in and just see how everyone is doing. Our first appointments start at 8:15. Each day is different, so some days we're like fully booked, or even, you know, double bookings the whole day from like 8:15 right up until 4:45, and other days we're really quiet where we don't have anybody booked for hours. So on the quiet days, I will try and start my day by going through my inbox and my task box. So that's where my buddy doctor, who I am I'm specifically assigned to will send me tasks and things to do. So this is mainly calling patients and letting them know of blood results or prescriptions that have been sent. So I try and get as much of those done as possible before patients start arriving. And then I see the patients and kind of, get to chat and, look after them. And then when I do have downtime, I can do inbox, but I can also do recalls. So again, those are things like our vaccination lists of people who are due for their vaccines, or their HPV swabs, or cervical screening, or diabetes reviews. So I'll call them up and try and book them in. And this is always difficult because people don't always want to come in. And a lot of people are also really, really busy as well. So it's always a challenge of the day trying to book appointments and get people to come in and, get screened, get vaccinated, because that's all of our prevention techniques to keep people healthy. It's really, really important, but it's not always easy getting people to come in. So I have a 15-minute morning tea at 10 o'clock, and then I have lunch for an hour, which will either be at 12, 12:30 or 1, depending on what was decided at our nurse huddle in the morning. I then have another 10 to 15-minute afternoon tea break around 3 o'clock, and then that's all of my breaks for the day. And it's been really, really good. I don't think I've ever had to miss a break, and when I have gone later for my break, my nurse team, we cover for each other, so I've never had to cut a break short or anything either, which I'm very, very grateful for. So then after my breaks, I'll keep seeing patients, working on my inbox and the recalls, and then around 4 to 4:30 we start slowly packing up and cleaning everything. So we will close the cabin, clean the nurse rooms and also the doctor's rooms when they are done with patients. We restock our treatment trolleys, restock the doctor's rooms. Our last appointment is at 4:45, and then at 5 p.m. I finish work. So I really love my working day because I personally thrive off of a set structure, and I love knowing exactly what I'm going to be doing. In the morning when we have a look at our timetable, I can kind of prepare for the day ahead because I know exactly what's going to be coming in. I also know that I will always start work at 8 a.m, finish at 5 p.m. on my set work days. So I work Monday, Wednesday, Thursday, Friday. We don't have shifts. We don't work weekends or public holidays, and we don't work nights either. And all of this just works perfectly for me. So onto the pros and cons of nursing, of practice nursing. So we'll start off with the cons and kind of get that out of the way. So first con is that general practice is part funded by the government, but then it's also part private healthcare. So this means that some treatments for some people will be free or discounted, while the same treatment for other groups of people you have to pay for. Or some treatments for everybody may be free, some treatments for everybody you may have to pay for. So our schedule vaccines are all free. No matter who you are, if you live in New Zealand, you can get those vaccines that are on the schedule for free. Whereas diabetes annual reviews, they are now a nurse consult fee for everybody. If you have a community service card, you still have to pay, but you get it discounted a bit. With our wound dressings, you can get it discounted or for free if it is an ACC or an accident wound. If it's not an accident wound, let's say you've got a surgical wound from the hospital, then you have to pay a lot of money for the dressings, the consult, our knowledge and time, and the care plan that we make. The con is that it kind of sucks that I have to make people pay for things, and it is a lot of money as well because GP clinics are still a business and they need income to be able to provide care, good care to people. And it's probably the thing that I hate the most about my job, because my personal value is that healthcare should be free, all of healthcare for everybody should be free, and having to make people pay for stuff kind of clashes with that value a lot. So I hate doing that. And kind of leading on from that in terms of funding, primary healthcare just in general is really, really underfunded. Secondary healthcare is also really underfunded, but secondary healthcare still gets more money from the government than we do. We kind of get any of the offcuts from secondary healthcare. Because we're so underfunded, there are just some things that I'm just not able to do or provide for people because it's too expensive for the clinic to be sustainable for the business plan. And again, that really sucks because you're if we had the money, we definitely could do this, but we don't have the money for that. So that's another con. Finally, primary healthcare doesn't really pay very much as secondary healthcare. So as a practice nurse, I earn less money than a nurse up at the hospital. And because we don't work public holidays, weekends or nights, we don't get extra pay or double time or alternate leave in lieu for those shifts because we just don't have them. So income, I'm happy with my pay because it still is like a huge increase from what I was working as, you know, doing checkout work at the supermarket. So for me, like, I'm really happy with it. But like, I don't want to know what my friends at the hospital are earning because I feel like that would make me feel a little bit shit. So I just kind of stay away from that and try and protect my peace and just focus on, you know, the joy of earning my own money and stuff. But at the back of my mind, I do know that I am earning less than a secondary healthcare nurse will. So again, another con. But those were really the only cons that I could think of. They were all financial, which I think says a lot about the actual nature of practice nursing. So let's move on to the pros, of which I've got a lot. So the first one is that because we work set hours and set shifts and stuff, we build a really strong like team collegial network and relationship. I feel really close with all of my colleagues and we all look out for each other, really have gotten to know each other and stuff, and it's just been really nice working in this really warm, friendly environment where, as I say, everybody just supports each other and looks out for each other. So strong team network, which I think it can be difficult to do up at the hospital when everybody is rotating on their shifts, so you're not always, you know, on the same shifts with the same people all the time, and I feel like it can make it a little bit difficult to really connect with people, or it takes longer to connect with people. I also love the structure. Going back to the shifts, I know exactly when my shift starts and when it ends. I know exactly which days I'm working. Because I know exactly what days and times I'm working, I can really plan my life around that. If I want to go out and see a movie or, you know, start a co-curricular thing, you know, I can really plan for it because I know when I'm working, and I love that as well. So again, that all comes down to me like thriving off of routine and structure. And again, kind of leading on from this, getting my weekends and my nights free. As you probably know if you've been watching my videos for a while, I am not a night owl at all. I go to bed 10:30, you know, like I'm really, like I'm not a night person at all. So not having to work nights, amazing. I love it. I have a sleep schedule. I wake up feeling refreshed. You know, I don't feel battered from the whiplash of, you know, doing different shifts and stuff. Because our clinic is closed on the weekends, I have a weekend. I haven't had a weekend in like 5 years since I started working at New World during high school, because I would work weekends so that I didn't really have to work after school. And ever since then, it's just been weekends because nobody wants to work weekends. So I ended up doing them, but now I don't have to do that. So
Love that for me.
I also think another pro that people may disagree with me on this, working in a GP clinic, there is overall less stress than you have working up in secondary healthcare. My first reason for this is that we are working with mainly healthy people. I'm not really too worried about someone dropping dead in front of me because generally you're quite well. You're coming in for your routine, your checkup and stuff. I don't know if that makes sense, but you know, like I just feel, you know, we're looking after generally well people, and that does take a lot of the stress off of your shoulders. The other thing is that we are looking after one patient at a time. Per nurse, we're looking after one patient at a time per appointment, whereas up at the hospital you could be looking after 6 to 8 to 9 patients at a time during your shift. For me, when I was doing placements, was very stressful because, you know, you've got the call bells going as well as like your regular things that you need to do, like the medication rounds and other treatments. At the GP clinic, you don't have that. People are booking in for their appointments. You get 15 to 30 minutes with your patients, and it's just all of my attention can just go into that patient and their family and stuff, and it's just wonderful. Like I don't have to worry about, you know, what do my other patients need, because I don't have other patients, I just have that person in front of me. So I love that, and that's also really great for reducing stress. Yeah, those are my reasons why I think practice nursing is like a less stressful career choice than like hospital nursing is. Again, that could be a hot take, but the way that I feel at work, I'm really stressed, and when I am, it's generally because a lot has suddenly started happening. The other pro is that you get to see people when they're generally very well, and you get to help keep them well, which is always great, because I found at the hospital when I was dealing with a lot of really sick people, you're treating people, but you're also trying to keep their morale up and keeping them motivated and encouraged and reassured, and that can be quite draining and also really sad as well. Whereas in the GP clinic, a lot of our patients are generally well. You can kind of have a good chat with them about, you know, how they're doing, how, you know, how's their family going and stuff, and it's just a little bit more like of an uplifting environment, at least for me personally. Because the patients are enrolled at your GP clinic, even if you only get 15 minutes of them one day, you're likely to see them again at another appointment, so you can kind of get to know patients and build a rapport with them over time. I have always felt more respected as a person and also as a nurse on my community placements and in a community environment than I have up at secondary health. I feel like community health is more holistic, both for patients but also for staff, whereas in secondary health you're kind of part of a machine to keep things going, and I didn't like that feeling. So I don't know if you can kind of relate to that, or if that just sounds completely insane. I don't know, but that was my last pro that I've kind of listed down. As a new grad in the community, I was really worried that I would get overwhelmed immediately by everything, but my team like slowly introduced me to things. They've always been happy and like ready to help me out, answer questions, supervise me, direct me, and so I don't often feel overwhelmed. And I know that when I do feel overwhelmed, I have people that I can turn to and ask for help. So yeah, these past like 9 months now have been really good. I'm just so thankful to myself that I did not listen to those older hospital trained nurses who told me that it was a dumb idea to go straight into community from nursing school and that it was not acceptable, because if I had listened to them, I would be stuck in hospital-based nursing, which was not suited for me, which I wouldn't have enjoyed. I feel like it would have killed my passion for nursing and wouldn't have encouraged me or let me like thrive. If you're thinking about going into community nursing as your first job, just do it. It's, you know, for me it's been the best experience ever. I'm so grateful that I did it, and yeah, I don't really know what else to say. Don't let anybody tell you that it's a dumb idea, because it's not. So that was today's video. I hope that you guys found it helpful or insightful. Let me know in the comments what you thought and what nursing job or what job that you do. Don't forget to like, subscribe, do all of that good stuff. I will see you next Monday with a new video. Until then, have a lovely day and a fabulous week. Bye.
It's rated X. That means you're extra.